of serving as the director of the Tennessee Bureau of Investigation. Again, we thank you for being here this morning. We wanted to hold today's event and plan to do so yearly as a chance to talk about the latest data on the state's illicit drug issue and what it means for Tennessee. It's just that important, and it just continues to get worse. In staggering numbers, we're seeing substances we've never imagined in quantities that we've never seen before. And it's taking a toll that causes pain and suffering for entirely too many Tennessee families. We have a profound problem with addiction in Tennessee, and there's a criminal enterprise that's getting smarter and pushing their profit. There's a lot to unpack here. First, let's look at the data. And for that, I'd like to introduce Mike Little, who serves as our TBI Assistant Director over our Forensics Services Division. As you may know, TBI runs the state crime labs, and in our Forensic Chemistry Unit, we often have the first insight into emerging trends in the state. Mike?
As Director Rouse mentioned, I'm Mike Little. I'm the Assistant Director in charge of the crime labs here at the TBI. And as he also mentioned, we run forensic chemistry units that test drugs seized in solid dosage drug cases across the state of Tennessee. We have units in Nashville, in Knoxville, and in Jackson. And we test an average or submitted around an average of 30,000 cases per year from all across the state of Tennessee. We don't investigate these cases at the crime lab. We don't often know why they're submitted, but what we are a good source of is aggregate data and identifying trends of what drugs are seen in Tennessee. And it's clear looking at the data that methamphetamine is number one. In 2021, we identified approximately 11,000 examples of methamphetamine, which represented about 36% of the cases that we see. In meth, we don't test it for purity. We're not required to do so under Tennessee state law, but it is clear in looking at it that the people who are making this meth know what they're doing, and they're doing a very good job of it. We're not dealing with homemade methamphetamine anymore. This is stuff coming in a crystal form that's clearly very high purity. And if meth isn't bad enough, I think the thing that's the greatest concern for us in the drug chemistry unit is fentanyl. We see both fentanyl and fentanyl analogs. Currently, that's the number 3 most common drug that we see, and we're on track in 2022 to see almost 5,000 examples of these cases, or about 17% of the drugs that we report are going to be fentanyl or fentanyl analogs. First of all, let's talk about what an analog actually is. If you remember when you were a kid, you played with Tinker Toys. You pull off one piece and add another piece, it turns into something else. Well, we start with the same basic structure for fentanyl, and pull off a piece, add another piece, and all of a sudden we have a fentanyl analog. We're now up to 25 different analogs that we've identified at the crime lab of fentanyl. It makes our testing very complicated, and it also makes the potency of these analogs a concern. For example, fentanyl on its own is about 100 times more potent than morphine. We see another analog of fentanyl called carfentanil. Carfentanil is 100 times more potent than fentanyl, or 10,000 times more potent than morphine. How do we see fentanyl? We used to see fentanyl mainly in heroin cases. It was mixed with heroin to increase the potency of that heroin. We're actually now seeing heroin decline because which sounds like a good thing, but the decline of heroin isn't because heroin has lost interest. It's because we're seeing more and more fentanyl. We're seeing fentanyl on its own in powders, but I think the greatest concern is that we're seeing fentanyl disguised as other drugs, submitted as counterfeit drugs. Most commonly, we see that counterfeited to be oxycodone, which is a little blue pill labeled M30. And we're going to take you guys up to the drug chemistry unit here in a little bit and show you guys kind of how the sausage is made. And when I talked to them yesterday, I said, hey guys, they'd love to see some counterfeit M30s compared to real M30s. Well, we had no problem finding the counterfeit M30s. I had 4 or 5 people come up to me immediately and say, I've got a case of counterfeits. We couldn't find a legitimate M30. So we're going to show you guys a picture of the legitimate M30s, and we have counterfeit M30s coming out of our ears that are almost always fentanyl. So all of that being said, Josh, I don't know if you want me to run through these slides some more. What we've kind of got are the top 10 drugs that we see at the TBI Crime Lab. Let me first begin by talking about how we test for drugs. We often get a pile of drugs submitted in each case, And so we're going to test each case to give the prosecutors the most charge they can get for that case. So oftentimes we're not testing the plant material, for example. We may skip straight to the crystalline substances or the powders because we know that's where they can get the highest charge for that case. The most common drugs that we see, top 10, number 10 was tramadol, and that represents about 1% of our cases. It's a prescription painkiller. Next is delta-9 THC, and when we talk about delta-9 THC in this form, we're talking about edibles, gummies, things that aren't plant material. And again, those are rising. Some new delta-9 similar compounds that we're seeing. One is called HHC, which is hexahydrocannabinol. And these are some of the other THC compounds we're seeing, delta-9, delta-8 THC, delta-10 THC. And as you can tell by looking at that, it's all just a matter of moving that one double bond around that ring structure. So there are some very similar compounds out there that we're seeing, and these are all being used for people to get high. We've even heard of one called THCP, which we have not identified yet, that is another analog of THC that's apparently 30 times more potent than delta-9 THC, so we're keeping an eye out for that one. Buprenorphine is the next, number 8 most common drug that we see. It's fortunately on the decline. It is an opiate-type drug that is used to treat opiate addiction, but it's also been diverted. It's being called prison heroin, for example, because it's easy to sneak into prisons, and it's a drug that's being diverted for use. Heroin is our number 7 drug, and as you can see, it's declining. That sounds like a good thing, but unfortunately, it's really because fentanyl has broken out on its own, and they no longer need to combine it with the heroin. Fluorofentanyl is one of the analogs of fentanyl that we see. And the fentanyl analogs are rising at an alarming rate. We're seeing those in nearly 17% of our cases, the fentanyl and the fentanyl analogs. And when we talk about analogs, in the center you can see what fentanyl looks like. And just by altering the structure of that molecule a little bit, you can get all kinds of different analogs. That makes testing very complicated. It makes potency a concern. So it's definitely something we're very concerned about. As of when I wrote this slide, we had 24. We just identified another fentanyl analog just, I think, 2 days ago. So now I think we're up to 25 different versions of fentanyl we've identified in cases. Cocaine is a long since drug that we've been seeing. Fortunately, cocaine is on the decline, which also sounds like a good thing, but unfortunately that space is just filled by methamphetamine, by fentanyl, and other drugs. ANPP is a drug that is a precursor to fentanyl. It is actually a scheduled drug in Tennessee, but we see that almost always with fentanyl as part of the manufacturing process. Finally, in our number 3 spot, we have fentanyl itself, which is now seen in about 12% of the cases that we get in. And again, the total fentanyl and fentanyl analogs represent almost 17% of the cases that we expect to see in 2022. Finally, cannabis marijuana, the plant material that we get in. For years and years, plant material was our number 1 drug. It has now declined to number 2. And we see both marijuana and hemp, and we have testing to differentiate between the two of those. Then the vast majority of the cases that we get in are, in fact, marijuana. That is declining, but it has been steady throughout the past. Finally, methamphetamine. Again, we're on track to see that over 10,000 times this year, and it has been rising throughout the years and now represents, I think, around 35 to 36% of the cases that we see. And we'll see some methamphetamine upstairs. Some drugs to watch, we call these the nitazines. They're a synthetic opiate that's similar to fentanyl in its potency. And we're now seeing 4 or 5 different versions of the nitazines. These have been tied to some overdose deaths up in the Knoxville area. So this is another drug that we're watching. Again, they're very potent. They were things that we never saw in the past, and now they've just come out of the blue. Next up is xylazine. Xylazine is a drug that we're seeing. It is a veterinary tranquilizer that we're seeing in combination with fentanyl in many of these overdose cases. It's a drug that really wasn't on our radar in the past, but now it's something that we're paying attention to because we are seeing that associated with a lot of fentanyl overdoses. Xylazine on its own, being a tranquilizer, is not, it doesn't react to Narcan. So oftentimes we may see situations where people are overdosing and are non-responsive to Narcan, and it's probably the xylazine that's responsible for that. Finally, what we did is we tracked the number of overdose cases that we get into our drug chemistry unit and compared that to the prevalence of fentanyl and fentanyl analogs that we're seeing over the years. And we're seeing that those track very well over the last 5 years. It used to be that in the drug chemistry unit, they didn't see overdose cases. The cases that they got in were people selling drugs or people distributing drugs. Now they're finding people with drugs that have overdosed. Either they've overdosed and survived or overdosed and died. And we compare that or correlate that to the fentanyl and fentanyl analogs, we're seeing that that correlates very well. All right, finally, next up is Tommy Farmer, and he's going to discuss some of the investigation side.
Thanks, Mike. Very concerning, obviously, what we're seeing in drug trends. As you may know, the Tennessee Dangerous Drugs Task Force works every day to respond to emergencies related to fentanyl and other drugs. They train the state's law enforcement officers on how to handle these dangerous drugs and advocate for policies to help address these issues in Tennessee and beyond. We're blessed to have Special Agent in Charge Tommy Farmer lead this charge, and I'd like to invite him now to share a few thoughts on what he's seeing on the front lines. Tom.
Thank you, Director. Well, as Mike stated, and the Director, many of the tools that we work with state and local partners, both in law enforcement as well as our community partners. We work very closely with Tennessee Mental Health and Substance and Service Abuse, as well as health and education. So drug endangered children, to bring in a lot of the awareness, also trying to present a total package to those. Some of the things that we do with law enforcement is providing them not only the training of the specialized equipment, but that they will need to respond to these hazardous situations. But we will also provide the trucks that are 24-hour response, as well as some of the specialized equipment that we put on display over here. Because an incredible difficult part of this, as Mike was talking about, in a clinical setting or a lab setting, to identify the substances that are out there. Well, what we have to do is for the protection of the community, protection of the citizens that are there, as well as protection of the first responders. We will often go out there with some of the specialized equipment that we have to try to not only identify, but to type it. And if it's identify something that's not there through a field testing, then that way we can divert it from potentially going into the crime lab and holding the crime lab or having something they don't have to test. It's not necessary. When we respond to the hazardous situations, often EMS, or we're all over the state, we do have response trucks that are throughout the state. And again, what we've done is that partnership with state and local and federal law enforcement and our communities is we will train them, equip them with the specialized equipment that they need, and then send them back to the communities that they're a part of with a handshake agreement that they're going to contact us, or they're going to help their brother in the next county or the next city over. And then we have these trucks, response vehicles that are strategically placed throughout the state that can respond to them. Some of the equipment, working with our partners across, we've got it on display from testing or identifying which of these synthetic cannabinoids. But the interesting thing, like Mike was talking about with the nitazines or the xylazine, and all of those, what we are is we find ourselves in an area where we're dealing with synthetics. It's not only synthetics that are being used or applied to cannabinoids, cannabis, marijuanas, but we're seeing it where there are concoctions that are mixed in with each other that we really need something like this type of equipment, and more importantly, we need the crime lab to be able to tell us all of the different substances that may be present, because we're dealing with illicits. There's no quality control here that we're dealing with, and adding one thing to another also not only changes the intensity, but it changes how it interacts with the person or the potential effects of the drugs. And this is on an everyday occurrence that we're responding out and trying to identify. And even though we do use this equipment, we still have the personal protective equipment that's there on the bottom with an encapsulated suit all the way to a level A protection with a self-contained breathing apparatus, as well as some of the potential decontamination equipment that we have as well. So the chemicals that are used, I would say this is a dichloromethane, and I would leave the scientists to be the ones to explain that much more than me. But I assure you, these chemicals, as we were going through in a recent assessment with scientists on the line, because we don't, even the experience, I may have been out there for a long time, I don't know what these things are. And so as we go through and we're trying to type or identify these, it's very comforting and scary at the same time to hear a scientist yell at you and say, don't touch that one, not that one. You better get away from this one. That's incredibly dangerous. So, but this is unfortunately the world that we're in. We have to be careful. If you don't know where it come from, you don't know the source of it, even though it's coming out of illicit, clandestine drug labs. And while they may not be making the food products or substances there on scene, it's what they are making at this location that's being transferred, that's going into, made into a paste or a butter or sprayed, reapplied. We're seeing it many times. They're just simply spraying it right on inert substances. So I would say marketing, these are the most recent examples that we've got alerts coming out from HIDA and from DEA talking about the rainbow-colored fentanyl tabs. And like Mike was talking about, we've had examples here in our state as well as across the country. And many times, while this may not necessarily affect the potency of the drug, it's just more of a marketing or how they want to, this is a particular group's drugs. And so they may use different tactics to identify them or to set them apart from the others. And with that, I would turn it back over to Director Roush. Thank you.
As I speak with my colleagues in law enforcement throughout this country, it's critical to note that fentanyl is not just a Tennessee problem. In fact, the CDC has identified more than 107,000 deadly overdoses in the past year. A troubling majority of those are a result of fentanyl. It is now, in fact, the leading cause of death for those 18 to 45 years of age, surpassing suicide, COVID-19, and car crashes. Just this morning, I was reading an article where our life expectancy in the U.S. has yet again declined. Second year in a row. Life expectancy has now declined 2.7 years in the U.S. That is unprecedented, and much of that is a result of this issue. So where does fentanyl come from? Well, we know that there are two Mexican cartels, the Sinaloa cartel and the CJNG, the Jalisco New Generation cartel, that are dominating the fentanyl market. They are using ingredients that they buy from China, and they can make an unlimited amount. And as someone who has worked in law enforcement for decades, it terrifies me. I'm not alone. In a recent interview, Ann Milgram, the administrator of the U.S. Drug Enforcement Administration, called fentanyl the most deadly, widespread drug we've ever seen. Working with our local, state, and federal partners, we'll keep doing what we can here at TBI to find, arrest, and prosecute those who are pushing drugs, including fentanyl, in our state's illicit drug supply. After all, it isn't just about drugs. We all know there's a direct link between drug crime and violent crime. That's something that impacts the quality of life of every Tennessean. But let me be clear, the drug trade is demand-driven. And to really see progress in the fight against drugs in Tennessee, we must work to engage and support those battling addiction. Connect them with meaningful and comprehensive services, and patiently work with them through every stage of their personal and difficult fight. We are blessed in this state to have an agency like the Tennessee Department of Mental Health and Substance Abuse Services doing that kind of work, and we are expressly and especially blessed to have Commissioner Marie Williams leading that charge. Commissioner?
Good morning. I am so grateful to be here with Director Roush, Assistant Director Little, and Special Agent in Charge Tommy Farmer. In our department, every day we think about what we can do differently, what we're currently doing, and what we can do better. We think about that with a goal to save lives in Tennessee, because way too many individuals, neighbors, family members, loved ones, church members, school members are dying. The numbers that we are losing to the disease of addiction, and especially the scourge of fentanyl, is distressing. So glad each one of you are here today, in particular those in the back that represent our partners with Department of Health, some of our staff members that work with regional overdose prevention specialists who actually go out into the community and train and teach about how to bring people back if they have overdosed. We know that what you do and the work that you see every day saves lives. We wanted today to start with a couple of few messages that would hopefully help those who are dealing with substance abuse, as well as those that have family members and loved ones that are struggling with substance abuse. The first one is people can call or text anytime to this red line number. This is a very important number that we have, 1-800-889-9789. If anyone is listening that is struggling with addiction, please know that help is there. It is truly possible to have recovery, to change your life, and to get back in track. We have been running this number with a nonprofit agency for over 30 years. The other key message that we want to say today is that we are truly grateful and blessed for our governor, Governor Lee, and the Tennessee General Assembly, who made sure that in their budget they included $6 million more, so $6 million more in our state funding to increase addiction treatment services for individuals that are struggling and have no way to pay. They also increased our recovery supports by over $1 million, and you can see this here. And then finally, the $18 million that we see, which is the provider rate increase. Many of us know that our providers are struggling with workforce shortage, and this money is really helping to retain people that are in the field as well as to recruit people. You'll also see our Creating Homes Initiative 2.0, 3.0, the statewide residential recovery courts, the recovery court capacity expansion, and then the criminal justice liaison expansion. I just saw one of our videos this morning of a criminal justice liaison. Under Governor Lee and the legislature, we've actually been able to have one criminal justice liaison now in every county. So that's 95 counties where individuals that struggle with mental health or addiction can actually get the help that they need. It's amazing when you look back in this state and you look at the resources that have been dedicated to help individuals that are struggling with addiction. You'll note that in 2018, we just had $86 million that were budgeted. You can see that right there. And look at what has happened since that time frame. In 5 years, our state, governor, assembly have given us 66.6 from a 32 million, and then 62 million almost from federal, with a total of 133 million. So we know that these dollars matter, and they're helping to save lives with those that are here today that do those services. The main reason we're here today, though, as you have spoken about, is the fact that it's International Overdose Awareness Day. And what's driving overdose is, of course, related to fentanyl that you all have so eloquently laid out. It's important, though, to separate fact from fiction when you're dealing with fentanyl, because Tennesseans are dying by overdose by the thousands. Think about that, by the thousands. So what we'd like to do right now is separate that fact from fiction, and it's our hope that these facts will help those individuals that are listening or read the words that you write. First statement, you cannot overdose by incidental contact with fentanyl or fentanyl analogs. Is that true or false? It's a fact. It's a fact. Thank you, though, for answering. To have an effect, I appreciate that. To have an effect, fentanyl has to enter your bloodstream, which means it has to be ingested, or otherwise introduced into your system. If you touch a suspicious powder, remain calm. Don't touch your eyes or mouth, and make sure that you wash your hands immediately. And then finally, fentanyl can also enter the bloodstream through cuts or wounds on the skin, so that's important to know, and wounds must be open and visible for that to enter. All right, we're going to go to our next one. Symptoms such as alertness, rapid breathing, or hyperventilating, sweating, chills, numbness in fingers, chest pain, or rapid heartbeat are signs of opioid or fentanyl overdose. True or false? Somebody go. False. Absolutely. Way to go. Those are most likely the signs of panic attacks and are not what you would expect if someone was struggling with fentanyl. All right. Next one. Fentanyl is showing up in vapes and marijuana. True or false? Fact or fiction? It is fiction. What we know there is that there have been reports of this, but it's never been provided by lab testing in Tennessee. That's very important to know. Is that still true, TBI friends? Still true. Awesome, thank you. All right, increasing fentanyl deaths are not related to pharmaceutical fentanyl. True or false? That is absolutely a fact. We know that when administered by medical professionals, pharmaceutical-grade fentanyl is safe and effective. And again, what we've been talking about today is what would be considered fentanyl that would be created or designed by people that are out to hurt you, not the doctors that are here to help you. The last one is only people who use opioids or heroin are at risk for fentanyl overdose. True or false? That would be fiction. It says fentanyl is being mixed into cocaine and methamphetamine, and it's being pressed into counterfeit pills. We just saw the rainbow pills, and it's very, very sad. The bottom line is if it wasn't prescribed to you, don't take it. Please don't take something that wasn't prescribed to you. Please understand that you're more at risk today than you could ever be related to taking a medication that looks like something that it is not. That is why we're having the thousands of deaths. Another total example that we're excited about that's making a difference are fentanyl test strips. We were excited this year that that got passed by our legislature to be able to use those. And what I'd like to do is bring up my friend and colleague, Anthony Jackson, Jr., Director Jackson. He's Director of our Prevention and Early Intervention Services in our Division of Substance Abuse Services, and he'll talk a little bit more about that.
Thank you, Commissioner. And you know, it's great to be here today, and I appreciate all the partners I email back and forth with sometimes. And as we talk about this, I want to start off with when the law was passed, the first thing we did was reach out to TBI. Okay. I appreciate, it probably came from your office, but Tommy, he gave us the list of analogs that they had seen. That list, I think it was 24 then, and now it's 25. And we used that as a basis for what fentanyl test strips do we think will be useful to start as a pilot, and then for potential distribution out across the state to those who are at risk of overdose. And so, you know, fentanyl test strips, they're a cheap, easy tool for people who are in active addiction. It's very low cost, and it's something that research has shown will adjust an individual's behavior. The way you use them, you take a small sample, mix it in water, you dip the test strip into the water, and then you let it dry. That's it. Now, let's be clear here. Fentanyl test strips don't pick up every single analog. I will say with the list that the TBI provided us, we picked the test strips that were going to be the most sensitive to our state, because every state's different, but at the same time, it is a tool that can be used. As we were doing our analysis, as we were working on the bill and think about, okay, what does the data show us? The data shows us that if fentanyl test strips are used, 70% of the time, people will adjust their behavior. Now, what does adjust their behavior look like? They might not use, okay? If they do, they'll have naloxone there. Now, we've been doing this pilot for probably about a month and a half. And so when we look at our data, Kate and I looked at it yesterday evening, and we looked at it, you know, I said research shows 70% of people adjust their use. In our state, our data so far shows about 81% of people adjust their use. And it was interesting because it wasn't just we use less. No, it was I decided not to use. The other side of the data piece before I finalize this part is I can appreciate where they talk about Methamphetamine is the most prevalent substance that they're seeing in terms of from a illicit perspective that they're testing in their lab. We see that also in our survey, and it looks like individuals are using these fentanyl test strips to test their methamphetamine because it is being mixed and laced with fentanyl. Kind of to close this out, I wish there was one that could catch every analog. We want people to be as safe as possible, but at the end of the day, what I want people to know about this pilot and our programs is we work to connect partners with a referral to recovery, a referral to other resources. So this isn't something that we're just giving to people uninitiated. We're actually trying to be very deliberate because everybody is on a pathway to recovery, right? Every single person. And a lot of it is, and I don't know how appropriate this is to say, but you cannot save someone who's not alive. If it's one of those 3,036 or so people that died last year from overdose, we can't get them services, okay? And I appreciate Director Roush's position where we've got to help them however we can. This is a tool. It's not the tool, but it is a tool that we're very happy to be able to provide in the state. Thank you.
Thanks so much, Tony. In closing, we want people living with addiction to know their life has purpose and meaning. We want people to know that their life has value and that someone out there wants them to live to see tomorrow and see that there's hope for a new life in recovery. We know that help is available. We know that there is hope. We know that recovery is real. We see it around us every day. There are people around you every day, probably in your newsrooms, probably family members, who right now are living lives of recovery, and we're grateful for their walk. Want to end by saying if you or a loved one needs free and confidential referral to treatment, please call or text the red line that we just showed earlier, 800-889-9789. You will get what you need and hopefully be on a better path in life, and will save more lives because of that. Director Roush, would you like to close us out?
Thanks.
Thank you.
Thank you, Commissioner. Thanks, Tony, for your all's great insight there. So at this time, we're happy to take any questions that you might have that we can answer for you.
I got a question for the committee.
Great.
Okay. Yes, sir.
I noticed that all the money that you spent there was for education. I heard a wise man say one time, we can't put them all in jail, but we can educate them to stop doing it. When did you guys change, from trying to just arrest them all and make everybody stop and just put them in jail? It's just like, hey, let's educate them, and maybe that'll work better.
All right, so just to sort of reframe, we have a lot of money in prevention education, but we also fund treatment, wraparound, outreach. So just make sure that that's clear. We're still funding those traditional intervention programs because we know that they're evidence-based. We shifted and went that way as we looked at research. In our state, in our department, we very much focus on what's evidence-based practice. And we saw the outcomes from having individuals that are living a life of recovery to hire those individuals that have 2 years or more of recovery to talk to individuals that are struggling. We have seen huge outcomes in that. One of our programs, the Lifeliners, again, these are people who have 2 years or more of recovery. Someone's overdosed in the hospital. They go in, they talk to that person, and we've seen a much higher referral to treatment and people getting into treatment by that intervention, much higher than someone else talking to them. So we would say that we really made that switch probably, I'd say 8-9 years ago.
And another thing too was, I know that most of your addicts, a lot of addicts that we've been talked to, say they started, they had a back pain, they got hurt, they went to the doctor, he prescribed it, and then I got addicted to it, he wouldn't give me any more,
Right.
so I had to find another way.
Right.
How are you guys, how are we going to figure out how to fix that? You know what I mean? That's something that just really is a stickler with me, that we need to find a way to fix that.
Absolutely. So let me say something about that. If you look at Prescription for Success, which was passed probably 5 years ago, I'd say, 5 years ago, you'll note in the state that we've seen a decline in prescriptions prescribed, and that there was legislation that talked about the fact that if you're on a pain medication for 5 days or more, then you have a higher likelihood to become addicted. So that's why that legislation has helped, and there's a huge decline. So that's awesome because it keeps new people from coming in the pipeline. But for those that have been addicted and were prescribed, again, all of the programs that we do, like the ROPES, Regional Overdose Prevention Specialists, Lifeliners, faith-based coordinators that are working in the churches and faith-based communities to explain to people, look, there's a way to get off of what you've got, what you might have gotten on, and we're funding major increases in detox and medically assisted treatment as well. Thank you.
Director Roush, I want to ask you about fentanyl test strips, which I know have been controversial. And
Sure.
I imagine there was a time TBI was not a fan of this, but
Sure.
it sounds like you all are cooperating, even helping with what test strips to be used.
Sure. Yeah. So the commissioner and I had a conversation about test strips, and we expressed our concerns of them. So we believe that there are opportunities that we need to understand and be prepared for, right? Because as has been mentioned before, we can't arrest the way out of this issue, right? Prevention on the front end is going to be the biggest key, right? And intervention is a huge piece, right? And so as we looked at it and we had the discussions about test strips, we expressed our concerns about what we thought they might be used for, and those guidelines and if you will, the guide or the bumpers, if you will, have been put in place to prevent as much as we can for them to be used in the way that we have seen them used, right? And so we've worked really hard to structure it in that manner, working very closely with the mental health and substance abuse services. And so it's been a great cooperative work to get there. I'm one that, as we have our conversations, I'm one that looks very closely at data. And when you look at the data on this, and what you just heard from Tony, the success, right? 70% change behavior. In Tennessee, in the first month, we've seen 81% of behavior change. That's the very first step, right? And so the success of it, we felt was worth it, right? And so we did adjust where we were. And it's not uncommon, this is, when I was in Knoxville, one of the things that we had brought to us from a coalition was needle exchange, right? And I was adamantly against it until they gave me the data. And when we looked at the data and saw the number of hepatitis cases and AIDS cases that drop as a result of needle exchange, it made perfect sense, right? And so then we initiated, and guess what? We've had greater success in reducing hepatitis and AIDS in Tennessee as a result of embracing that piece of it, right? And so there are harm reduction strategies that have great evidence behind them. And those are the ones that we are consistently talking about and consistently looking to see how we can implement them with guardrails in Tennessee to protect our citizenry, right? And so and those who reside in Tennessee. And so it wasn't hard to get there when the data was provided. And then what we heard this morning from Anthony, I think that gives us even more confidence that it's the right move.
Let me ask you one more sticky one
Sure.
then. And that is cannabis, Delta 8, Delta 9. I mean, I think there are people here in Nashville who thought, I didn't know that was illegal anymore because they're selling it at 5 points. I mean,
Yeah.
So I wonder, what is your all's approach, kind of taking up the time of the crime lab when some parts of the state are not even treating this as an illicit substance?
Yeah, so our approach continues in that it is an illicit substance. It's still a Schedule I on the federal level, and as long as it remains a Schedule I on the federal level, we will enforce it. And while there are certain communities that are not being as aggressive with enforcement on it, that doesn't change the way that TBI is approaching it. And we are working with legislators to try to fix basically the mess that has been created by all of these, frankly, the big marijuana. That's who's pushing this narrative. That's who's pushing this effort, right? They continue to devastate communities. When you look at what's going on in Washington State, in Colorado, in California, in these states that have gone full-blown with this stuff, they are all walking back, right? And so why would we walk into something that everybody else is looking at that have been in it for 10 years, and they're going, whew, we've made mistakes, right? California has just increased their budget to enforcement on this stuff, right? And so when you start talking about this stuff, you got to be educated. You got to understand, first of all, who's making the money, right? It's no different than big tobacco back in the day. It's the same thing. We've got big marijuana, large corporations making the money off of this. We have cartels that are engaged completely in this operation, right? So, what you hear is, well, we want something for our mom and pop farmers and, to grow and make some money on, and that's not who's making money on this. Most of the mom and pop farmers who got into the hemp industry are out because they found out there's no money there, except for those who take advantage of the illicit side of it and the things that we're finding where they're spraying THC in it, right? And they're juicing it up, and they're selling it as hemp, and it's not. It's these THC derivatives that are dangerous, right? And we've seen the decline in our youth usage. We've seen an increase in the usage and a decline in their abilities to protect themselves. And so we're seeing higher levels of youth usage throughout the country. We're seeing it in Tennessee, right? We're seeing higher levels of youth usage, which is dangerous because they say sustained usage by youth it causes them to have mental health issues, right? And so these are facts. Again, I look at evidence, right? None of this is my personal fight against a drug that I have fought for my life, right? But it's about facts, right? And so when we start deviating from what the facts are, that's where we move into trouble. And that's what we've seen, unfortunately, throughout the country. In states that have bought into the lie that big marijuana has sold them. And, the whole concept that the money is going to be able to, to bring in these great tax revenues and all that. Well, what's the cost, right? Yeah, they're bringing in revenue, but what's the cost, right? You saw the budget for for Marie's division, her department. We'd have to increase that exponentially if we keep playing this game with marijuana. And so I'm adamantly against it. We will continue to fight against it. The Bureau will continue to stand against it, and we base that on facts, not on emotion.
Are you seeing more, I guess, professionally packaged marijuana from these states that have legalized it, or is it kind of illegally grown in here? Like, what is it?
No, so we're seeing a mix of it. Most of it is coming in from other states that have, and what they're doing is, as a matter of fact, they just found it at the state fair, right? They're selling it as hemp, and they're putting stickers over the top of what it really is, right? And we just had some that was delivered to us from the state fair that peel the sticker back, and it had it listed as 500 milligrams of hemp, and when you pull the sticker back, it's 600 milligrams of THC, right? And so that's the lie. That's what's happening, and it's all about money. That's it, and that's where we've got to be better. Tennessee has got to be better.
I'm old enough to remember my first meth bust that the state had, and it was a couple of guys in a garage cooking and creating something that may have failed chemistry or something in high school. Can you or somebody address how this is now kind of transitioned from two people making their best guess to like a whole industry that is involved internationally, and the difficulty in fighting that battle?
Sure.
It's still number two.
No, it's number one. Methamphetamine is number one in the state of Tennessee. and it's number one throughout the country, frankly. And you're right. The day of a couple of fellas in their garage mixing it up and making it are very rare. We have, fortunately, a lot of things were put in place. Initially, the methamphetamine task force, who's now is transformed into dangerous drugs, did a lot of work in this space. And then there was legislation that helped tremendously to control precursors, and which was a great move. However, when there's a void, there are illicit actors that will find a way, right? And that's what we have seen. We have seen, frankly, we've seen the cartels understand the business model and understand that this is a substance that has great demand. And so they have filled that void, and they have done it in a way that is unprecedented. You know, initially, a lot of the meth was coming in from China. That got controlled, got stopped. But what didn't stop is China's involvement. So China now sends precursors to the cartels, and the cartels have numerous labs throughout Mexico, and they are manufacturing it in those labs. Now, these are folks who are not necessarily, not all of them are scientists, right? They are mixing this stuff up, and then and they're mixing it in different ways with some of the typical narcotics that come across with methamphetamine and heroin, and cocaine. But what they also do is they're pressing these pills, and they're sending them across. And so, and then most recently, what they're doing is they're just sending the liquid, right? So they're making it up, they're putting it in a liquid form, easier to transport it, easier to get it across the border, and they're getting it into the country, and then they're going to conversion labs. And those conversion labs are then turning it into powder, and then they're pressing the pills. You know, we're bringing in pill presses all the time where we hit these locations, and they're pressing thousands and thousands of pills of pure fentanyl. And most of them, right, again, these aren't scientists, folks. These aren't the folks these aren't your pharmacists, right, that have gone to school for years to learn how to properly mix and to assure that there's a proper balance in a medication, right? These are street thugs who are mixing up this stuff. You may get a pill that's not going to kill you, right? But I'm not sure I want to take that chance, because the next one may have, and it may be the same. You may cut the pill in half. Half of it was okay, but the other half has a higher concentration. It's just a couple of small molecules, and you're done, right? And that's what scares me more than anything with where we're at. But in terms of methamphetamine, it's been an evolving product, and it continues to. Again, what's happened is that the cartels have realized they don't have to worry about growing season anymore, right? There's no need for a growing season when you can manufacture it all in a lab. And so they manufacture fentanyl and they manufacture methamphetamine in labs and don't have to worry about agricultural growing seasons. And the space that they use is much smaller, so they can set up a lab almost anywhere. And so that they have an amazing distribution network, better, frankly, than Amazon. And they have cartel members that are here in our communities in Tennessee that are running those operations. I mean, I can go through, not only that, but then the money laundering operation that takes place that also has Chinese connection. And so it all has this connection of China and the cartels working very closely with each other. And I won't get into it, but I can tell you I think there's more to that whole story. I think there's a more nefarious attack happening here.
So with Narcan, and I know there's the stronger or the double dose Photo now, how many of these drugs are you seeing, one, are taking more doses to kind of help someone, and how many are just not working at all?
Yeah, so naloxone, it's getting more complicated. You know, we're hearing reports from the field. Tommy's team does a great job of tracking naloxone use throughout the state. And we're hearing reports from the field that it is taking more. And as was mentioned by Mike, there are drugs that are now hitting the area that won't respond to naloxone, to Narcan. And so, but it is taking more because of the purity of this stuff, right? And that's again, higher concerns. It's, you know, we have done more, you know, in terms of the legislature this time. We actually, you know, it's now the law where if they're going to prescribe, that when they prescribe a narcotic, they're prescribing naloxone with it. And then anyone that wants naloxone can go to a health department and they can get it, right? So if you have addicts in your family, if you have people who are stuck in substance use disorder, we highly recommend that you have naloxone on hand. It absolutely is critical. And, you know, and every family, as was mentioned, every family, my family has been impacted by this. And so it's devastating, right? And, you know, it's the reality of the world we live in today. It's tough.
Are you able to talk about the needle exchange programs at all and what that's kind of looked like in the last year?
I think probably, I don't know if you all have,
Yeah, that wouldn't be something that.
we have right now. Yeah, those are generally, those exchange programs are run mostly by coalitions.
Local.
Yeah, local offices. And so I would, for Knoxville, I would encourage you to go talk to Karen Pershing at Metro Drug Coalition. She was the champion of that in Knoxville, and so I would encourage you to have a conversation with her.
Maybe one more question.
When you guys have success making an arrest or breaking us, where are you experiencing that success? Because it sounds like it's a tremendous, huge operation that's organized. I mean, where is the link that you guys have been able to find the greatest success in stopping this kind of stuff?
Yeah, so our Drug Investigation Division does an amazing job at working with local and federal and state partners at going after these individuals that are pushing and distributing the drugs in Tennessee. And so there are a number of ways that we are engaged in that. So obviously traditional drug enforcement is one way. And what that does is it removes, at that opportunity, it removes that group from the distribution network. Now, we also try, as we do that, working with the Dangerous Drug Task Force, is then try to move into that community and do some education, right, to attempt to reduce the demand. That's a big piece of it. And so education and services to reduce that demand. So when we go in and we take out a group, we're working very closely with our partners to come in on the backside of that and start to make a difference and change in that community. And so it's really, we're you know, there's sometimes a feel that it's whack-a-mole, but you know, I don't see it as that. I see it as we're taking and we're changing communities one at a time. And it may be neighborhoods, it may be a street, but we're changing them one at a time. And that effort will continue. And another piece of our enforcement effort is with overdoses that result in death. And so we have teams throughout the state now, and we continue to train up local law enforcement in how to respond to those calls. And so they're being investigated. It's no longer just being written off as a accidental death, right? So now what we do is we investigate these as homicides. We're seeking to determine who provided that drug. And once we can figure that out, then what we have found is we start making connections to the distribution network. And that leads us to the larger investigations where we can take down these networks. And so we have, you know, we've had great success in that. We have in those arrests taken down cartel members. We have a number of very great successes at doing that. That's why we know the cartels here in Tennessee, because we have taken them down. We have removed them. We have them in custody. And so And we are continuing to work with our federal partners, international, to interrupt that network as well.